to congratulate both of you. I just want to congratulate both of you. Actually, this is a nice initiative that is taken by the IMA MSN team, and which is headed by Nandini Shrija. You are doing a nice job. I think most of the people you are getting benefited by it. So it will always, instead of we projecting something, if it is better to get an advice from your peer group and then just passed out group, it will be very useful for you. And I'm very proud that you are sparing your time to educate these your juniors. So you're just helping them to come up. But why the participants is so less? I think hereafter they will join. After some time they'll join only 24 because at the first meeting when I saw you are near 100. I think so. Just try to
Yes, ma'am, they'll
encourage
be
this.
they'll be done soon.
Now,
They'll be done soon.
I think in due course they will join. Just tell your friends to make use of it. Because this is a nice opportunity for you. That is our profession mainly grows by contacts and communication. Okay, so nothing else will be there. Only by contact and communication, proper communication and contacts, we will be able to grow. We must help each other. These people are doing, so you have to make use of it. So tell your friends to make use of these opportunities. Okay, right? Yes. Develop your skill, communication skill, and then contacts also you have to develop. Yes, okay. Congratulations and all the best for your future endeavors also. All the best for all of you. Tell your friends, there is participants, please tell your friends to join, to make use of this opportunity. Okay, Pa, thank you. Thank you for the invite. Thank you. You carry on. I just don't want to take much of your time. Just you carry on. Thank you. Thank you, Ma.
Thank you, ma'am.
Okay, thank you.
Next, we invite member of JDN, our beloved Shrija ma'am, for a welcome address.
Welcome everyone for the session of Thiran. This is our fifth session. We have done successful sessions in the past. There were 4 sessions till now, and this is going to be our fifth session and much needed. And many have requested for this session on USMLE, and we have got two wonderful speakers. One is Shabarni and Aravind. Both are of our TVMC Trinalveli Medical College, and I'm proud to say both of them are my classmates, and we learned together, and we were batchmates, and we had good memories together. So I'm happy that they have achieved their best in this level, and they are here to educate us more on USMLE and also solve all the questions we have about and regarding USMLE. And I hope everyone will make use of it. As Pratibha ma'am said, the first session we had 100 participants, and ongoing there were reduced numbers depending on the sessions. But I hope USMLE will be a great educating topic, as we are from India, and many of us want to explore more in abroad. So I wish more of us will get benefited by this session. And without further ado, we'll move on with the speakers. Uh, I I request Darshana to introduce the speakers, and we'll go on with the session. And I welcome everyone for this session.
We welcome our speakers for Thiran Session 5, alumni of our college, Dr. M. Aravind of 2017 batch of TVMC, past chairman of MSN Tirunelveli. He cleared all the steps in USMLE and also cleared MRCP. Our second speaker is also an alumni of our college, 2017 batch of TVMC, Dr. Sabarini Kumar. She completed all the 3 steps of USMLE. Welcome, ma'am. We request you to please take over the session, sir and ma'am.
Thank you so much, everyone, for this warm welcome. It's an absolute pleasure for us to address the juniors regarding this journey. First of all, I would like to get a quick poll of the participants here. We would like to know, like, which year of medical school are you from, or are you a graduate, so that we can know, like, to whom we have to focus our plans to. So, like, can you just quickly type in third year of medical school? Yeah, third year, final year. a quick text in the chat, please. See, final year, final year. Okay. Okay, there are post MBBS as well. Okay, then we'll try to keep it broader. Final year CMC. Oh, nice. Okay, we have students from other college as well. Okay. Okay, so firstly, we would like to take this session by talking about four broad topics, which are the major pathways in the USMLE. Firstly, about the exam preparation. Secondly, the people networking. Thirdly, CV building strategies. And fourthly, the timeline of USMLE that you can have. Firstly, to start with the exam preparation and when should you apply, the resources that you have to use, and how should you be approaching the exams. I call upon Aravind to talk about the exam preparation. Yeah.
Thank you so much, Rija, and thank you so much, Shavari, and thank you so much, Darshana, for the warm welcome. So today, we're going to see about how to approach an USMLE examination. So there are various pathways available post MBBS. So one may be MRCP or MRB or NEET PG or USMLE AMC or whatever. So the key thing for any exam is the strategy. So you must know about what's the procedure of the exam and what are they testing in that exam, and you need to train accordingly so that you can ace in any exams. So that's one.
Aravind, I'm
So
sorry to interrupt, but your volume is too low.
is it too low?
Is there anything that you can do about the volume system?
Just give me 1 second.
Yeah.
How about
Okay.
now?
Meanwhile, when Aravind fixes his volume,
Is it fine?
no, Aravind, it's still very low.
Is it still very low? Oh my god.
Yeah.
I'm so sorry.
No problem.
Yeah,
Meanwhile, maybe focus on
so
something
it was
else.
better. Yeah.
How about now?
Okay.
Is it fine?
It's the same, Aravind.
It's the same. Oh my god.
Yeah.
Okay. Shabani, can
Okay,
you
not
please
to waste the time of
speak
the
louder?
participants. Meanwhile, maybe I'll go on with my thing
Yeah, please.
until you fix this. Okay. So, firstly, when you have decided yourself that you're going to take USMLE, I would say the key things are believe in yourself. Okay. There are going to be various instances in this timeline where you will have lots of self-doubt. And when you compare yourself with your peers, you would feel that they have got into post-graduation, they have got into job at times, they have started earning. So never have the mindset of comparing yourself with anyone. Just believe in yourself, trust the process, and keep working on it. Please try to avoid self-doubts, I would say. We'll not be able to say that you should not have it because even till date, at times, even me and Aravind, when we talk, we get the self-doubt till this date. So this is a very common thing that happens in this process. I would just say, besides all of that, just keep going and never let the trust go. Okay. How's the speaker? Aravind, you're on mute.
How about now?
Yeah, it's better.
Okay, so I don't know why I'm hearing.
But not very clear yet.
Hello, is it okay now?
Actually, I see you have joined from two devices.
Is it connected?
You have muted the one, and also please reduce the volume in one of the systems when you have two systems nearby, no? Because there's kind of echo. Yeah.
I even did that. How about now?
Yeah, it's much better.
Hello, is
Yeah,
it
it's
still
better.
echoing?
Yeah, go ahead.
Okay. Okay. Is it fine now?
Kind of little echo.
Hello. Still echoes.
How about now?
Back to that very
Is
low
it good?
case. No. It's too low again.
God,
Oh, so sorry.
I don't know what to do. I'm so sorry.
Yeah, that's okay. Please take a couple of minutes and try fixing it. Calm down, okay?
Maybe how
I'll
about
take
now?
over until then.
Is it fine?
It's the same. The same.
It's the same? Oh,
Mm-hmm.
Anyways, he's
Okay.
audible, ma'am.
Sorry.
Anyways, he's audible, ma'am. That's not an issue for
Oh,
us.
okay. So is it audible for everyone? Is everyone okay with that? I thought maybe it was not clear.
Shrija, can you please respond?
I think the audio is still low. I think Shabrini can continue, and Aravind, you can. I think if the audio is low, you can join in from only one device and speak without the video, if
Actually,
that's.
like
I
I
think
joined in
some
with one
participants are
device and
telling they are able to hear Aravind clearly. They are saying like it's manageable, it's good.
the
If the
audio
Okay,
is good.
then
participants,
I think you can. Yeah, Aravind, you can continue. Then let's go with it.
okay.
Am I audible? Is everything good? Hello?
Yes, sir. It's very good, sir.
Okay then.
Oh, thank you. Thank you for confirming. So, okay. So about USMLE, it's okay. So there are a lot of options to do post-graduation abroad after MBBS. So one of the most, fascinating way is USMLE. So about USMLE, it's actually a United States Medical License Examination. So after you complete your USMLE examinations, you are allowed to do a residency in the US, which corresponds to a post-graduation in India. Okay, there are a lot of numerous residencies available. You can choose any of those residencies, but the most commonly chosen residency is always internal medicine and family medicine. So before that, we can look at the steps of USMLE. So one is USMLE has three steps. So one is USMLE step 1, and then USMLE step 2, and USMLE step 3. So to apply for the residency in the US, USMLE step 1 and step 2 is enough. And you also need to do another examination called as the OET examination, which is an occupational English test, which is a test for English proficiency. Got it? So once you're done with USMLE step 1, step 2 and OET examination, you will be ECFMG certified, and after the ECFMG certification you can apply for residency in the US. That's how the process works. So that's the overview about the process. So let me talk about like how to approach these exams and what's the right time to give the exams. So you need to schedule, or you need to have rough schedule on yourself in your mind. So whether if you're a first year medical student, or if you're a final year medical student, or a post MBA student, so the timeline, there is a difference in timeline for all these three categories. So to give your first year, USMLE step 1 examination, so they actually test for your basic clinical subjects, so which will be mostly your anatomy, physiology, biochemistry, pathology, pharmacology and microbiology, and your biostats too. So these subjects will be tested in USMLE step 1, but it won't be just that examination. It won't be that questions like similar to your NEET PG. It will be somewhat clinical based. For example, if they're asking about, let's say, there are various coronary circulations, right? So there are three major arteries. They will be just giving a scenario where the patient may have a nausea or vomiting, and at the same time there may be some ECG changes in leads 2, 3 and AVF, and they will be asking about what's the culprit artery in that. So then you must be able to associate what's the type of artery, and if this artery is involved, so what could be the problem, and thus you need to say that it's a right coronary artery. So that's how the question is. though they will test your basic knowledge, they will be trying to judge whether you're able to apply your basic concepts in the clinical part. You got it? So that's how the exam system is. For example, if it's a biochemistry, let's say we are encountering a patient with an alcoholic patient, and definitely he must be having a lactic acidosis. So what would be the most common cause of lactic acidosis in such patient? So that will be the sort of question. So we need to associate that, okay, fine. Vitamin B1 is associated with pyruvate dehydrogenase complex. So that can, if that doesn't happen, it can lead to lactic acidosis. So we need to correlate alcoholics can have a vitamin B1 deficiency, and vitamin B1 deficiency can cause lactic acidosis. So that's how you need to approach the exams. So it's not just knowing, okay, fine, vitamin B1 deficiency causes lactic acidosis. That doesn't work that way. It is actually a combination of 2 or 3 systems. How you're able to implement your step 1, the study material called as USMLE, sorry, UWorld. There is a valuable study tool called as UWorld. You can use that, and there's also another tool called as Ambos. So UWorld costs about 40,000 rupees, and Ambos also costs about the similar thing. And if you can buy Ambos for all steps for about a year, so there is a lifetime package too. You can opt for that. So for USMLE step 1, they test the basic subjects and whether you're able to apply basic concepts in your clinics. And on the other hand, you can use UWorld and Ambos, and the cost of the subject is, the cost of the examination is about $120, and if you're applying it in India, it may cost about $1,200. $1,000 for the exams and extra $200 for writing it in India. So totally it costs about 1,10,000 rupees for step 1. And for step 2, it tests about how you approach the patients and about the guidelines. If the patient comes to us in this stage, and what will you do next, and what is the best step in management, or what's the next management which you will do. So that will be tested in your USMLE step 2 examinations. So for that examination, you can use again UWorld question bank and your Ambos question bank too. And after using these 2 question banks, there are 2 assessment exams. So one is NBME assessment exams, and another one is the free 120 examinations. So after completing the question banks, you can jump into self-assessment examinations, and after giving the examinations, you can appear to the exams. So step 1 is a pass or fail system. You don't need to secure any sort of good marks, that you either pass or fail. That's the thing. So for step 2 examination, it is actually the result is given as score format.
ஒரு
So the
சின்ன
score is
பிரச்சனைனால அப்புறம் அப்படியே இதாயிடுச்சு அதுக்கப்புறம் வீட்லயே உட்காந்துட்டு அப்புறம் யார்கிட்டயும் அதிகமா பேசுறேன்.
Yeah. So step 2 is a score based examination. Like any score about 240 or 250 is a very good score. And after giving your step 2, like you may give your OET examinations, then you'll be able to apply for your ECFMD certification. So the ECFMD certification alone costs about another $1,000. So from till now, so the first thing is you need to apply for ECFMD certification, that is around $560 at present, and you need to do credential verifications. For example, to say that whether you're a graduate of this med school, and what is your position, and about your name, discrepancies and stuff. That may cost about $200, and for step 1 examination it may cost about $1,200, and your step 2 examination it may cost about another $1,200, and your OET examination will cost about roughly around 31,000 rupees in Indian amount. So after this, completing USMLE step 1, step 2 and OET, you can apply for ECFMD certification, which will be about $965. So once you're done with your ECFMD certification, you're eligible for applying for the residency match cycle. So it will again cost about another $1,000 too. So this may think like it may cost a lot of rupees, but still, what I can say is everything will be really rewarding. That's what I can say. Yes, of course. So it requires a lot of investment first, and after doing this investment and your continuous effort, your resilience and perseverance, it will definitely pay off. So after you're done with the USMLE step 1, step 2 OET, examinations and obtaining your ECM certification, you can go for your observerships. That will be handled by, I think, Shabrini will discuss more about it, or else I can discuss about later. So you can do you need to do at least 3 months of US clinical experience, so that you can get at least 3 letters of recommendation from the US physicians. And on the other hand, like you need to also get a letter of recommendation from a home country, which will be mostly your department head or the head of the department of internal medicine. So after obtaining 4 letters of recommendation, then you will be able to apply for the match, and after your match cycle, you can place in some residency programs. So it's recommended that like if you can complete your USMLE Step 3 examination before applying for the match, because you will be eligible for your H1B visas. Right now there are a lot of discrepancies with the visa too, but still you are eligible for H1B visas too. So this is the entire step, and for step 3 it will cost about $900. So that's a major thing. So for step 1, step 2 and step 3, UWorld is the gold standard Q bank, so you can use that. And for step 1, most of them use the first aid book, which is used by Shabrini too, but I didn't use that book. I'm not a big fan of that book, but still, first aid is a very good book to be used. And for step 2, again UWorld, and for step 3, again UWorld. And for step 3, there is another question bank called a CCS Q bank, so you can use that too for CCS cases. So it's like a simulated cases and stuff. So that's all about the exams. So about the timeline of preparation, if you're in the beginning of first year, I'll recommend you to give your USMLE Step 1 examinations at the end of second year. So only during the second year you will be attending your clinical postings, and you will be getting exposed to your clinical cases, and you can at least try to use your basic knowledge in the clinics. If you're just giving your exam soon after your first MBBS, then there is a very high risk that like you may even fail the examination. But after your second year, at the end of your second year, like if you can give your USMLE Step 1 exam, that's actually a very good chance. Or else, like you can give your exam during your third year of MBBS, and once you're done with your USMLE Step 1 in your third year of MBBS, you can give your Step 2 examinations at after the completion of your final year examinations. So after completing your final examination, if you can use some step 2 examinations, and after completing your internship, you can apply for observerships and pursue your US clinical experience there for about at least 3 months or 6 months. So whichever you're willing to. So that would be an ideal timeline schedule for a first year MBBS student. So step 1 in first year, step 2 in after completion of your final year MBBS, and US clinical experience after post CRRA, immediately post CRRA. If someone is in the final year of MBBS, so it's better that you can take your exam, step 1 examination first at the end of your final year examination, and your step 2 examination at the end of CRRA, and then go for US clinical observerships and continue with the residency math cycle. So that's a good point. If you're post MBBS, you're really free to do whatever exams you want. So it's the schedule is completely in your hand. So the only thing which limits your exam taking capability is the preparation for the examinations. So the preparation for USMLE Step 1, because I started my my timeline starts only after my CRRA period. So I got my first passport in October 2023, sorry. After 3 months after my CRRA, I got my first passport, and then I applied for the examinations. I sat for the examination in April 2024, and then I gave my USMLE Step 3 examination in September 2024, and my Step 3 examination in August 2025. So that's my timeline. So step 1 preparation, it hardly takes about 6 months, and for step 2 it may take another 6 months. It's better to give your step 1 examination first, and then soon after your step 1 examination, if you study for your step 2 examination, it will be really easy for you. And after you're done with your step 2 examination, it takes about maybe around 2 to 3 months for your step 3 examinations too. So the overall timeline, if you are a post MBBS graduate, so then it would be about 6 months for step 1, 6 months for step 2, and then other 3 months for step 3. So totally you'll be able to complete within 15 months of preparation. So all the 3 steps, and in between you can give your OET examinations. You need to get your visa, and then you need to apply for US clinical experience, and you also need to develop some research experience too. So USMLE is not like one job at a time. You must be really multitasking. So at the same time, like you need to apply for visa, you need to prepare for the examination. At the same time, you also need to apply for observerships, and you need to do some research papers. So you must be really a multitasking guy to complete journey. And of course, like this journey will be really very frustrating sometimes, and sometimes it will be rewarding, and most of the time it will be really frustrating, but still all your hard works and efforts will definitely pay off, I think. Shabrini, so Shabrini will continue
Yeah,
the next
sure.
part. You want to add something, Shabrini? Shabrini, do you want to add something?
Yeah, sure. So, okay. Yeah, as Aravind was emphasizing, multitasking is really important in this journey because um, it is already a long journey where you have to accomplish several aspects before you are even ready to apply for the residency, because you have to get done with your exams, with clinical rotations here in the US. You need to have research experience, and in addition, you need to have various other experiences as well, like volunteer experiences and additional things that you can highlight or make your CV into a very unique one. So when you have to focus on too many things, it's not advisable to take one thing at a time, because the journey already being like a marathon, you really need the multitasking skills to take it forward. So I would like to start with emphasizing the importance of networking in this journey, because um, this journey is completely new for us, and this type of preparation, because in our country we are used to give study hard, give exams, and based on the score we get into the specialty of our choice. But it's not the same way happening here. There are multiple things, as we were telling, that we need to focus on. So, firstly, we need to know about the process, and secondly, how efficiently we can do the process, right? So, networking is really, really important. It will help you way beyond many other factors in this as well, because the US system, with people applying globally, US people really want someone who they can rely on as a resident, rather than just marks or being a bookworm or just focused on community. They want a holistic candidate, so whom they can trust and rely on. For a US person to hire someone from other part of the world, from India or from China, how will they know that? How will they know about the reliability of the person? So if someone really vouches for you from the US, telling, be it your seniors or be it your any relative or the attending that you meet during your rotation, when they vouch that I have worked with this candidate, he is good at clinics and in professional ethics, I would really support him and I recommend him to hire in your residency program. That word actually goes um, way beyond things would actually matter at the end. So networking is really important, and how you can start with this is that when being a medical school student, it would feel like we don't really know anyone and just like a one dot. But for everyone it starts that way. How you can start is that firstly you can try approaching your your college alumni. Okay, so you can reach out to your seniors and your friends from other colleges, and you can reach out to their seniors. You can talk to the postgraduates of your college and ask about their batchmates who are in US. You can reach out to the faculties of your college asking if they have their batchmates in the US. That's how this journey starts. Though you have been introvert all your life, it is high time that you start communicating with everyone, because that the communication skills is really necessary. So start approaching people, and also the more people you go telling that I am in this journey, I'm looking for people whom I can connect with and improve my CV and things like that. It also emphasizes your commitment to the journey, right? The more people you tell to, the more accountable you are to stay in that journey. That is again a driving factor for you as well. So when you start networking this way, and also you can even reach out to your relatives, because I think there would be no household without at least one relative being in US, right? So if they have been for a good amount of time in the US, you can ask them like if they know any Indian doctors over there. And that's how you start building connections. When you get like one contact from the US, from there on you can start developing and spread your web of connections. So that's how much networking is really important here. And so when you come to US for US clinical rotations, again it will be very helpful. Like for instance, you would have to go to New Jersey for a month, you would have to go to um Chicago for a month, and you can reach out to your seniors asking like, I'm going to stay here for a month, would you recommend any places for me to stay, where it would be cost effective, or you can even share your rooms with your seniors. That really happens. We ourselves have done that, myself, Aravind, with our college seniors being so helpful. So networking goes way beyond all the sometimes beyond all the exams and the activities that you do. That's how important networking is. And networking also helps in seeking clinical rotations in the US, because these days things being very competitive, it's not the same like you just email to a program and they're responding you back with a rotation. That's not how it works. Everything here is so demanding and competitive. So to seek rotations, again, the networking is going to help you. Aravind, would you like to talk about the rotations, or shall I go ahead with that?
So actually, okay, yeah. So about the rotations, like, so one thing is like you may be interested in any sort of residency, whether it's IM or surgery or whatever it is. So everything is doable. Everything is doable. I can assure you that. But what I can say is like if you can start that as early as possible, that would be really great. So if you are choosing a residency, try to choose it as early as possible is one thing. On the other hand, if you're if you have chosen your residency, try to show some interest on that. So that's what I have. I told that in the previous meeting too. So you can better show some volunteering, or you can show some observership skills on there, or you can do some procedures, or you can do some awareness events or camps, or whatever it is, or some research topics on that, or maybe a case report or review or whatever it is. So if you can show some interest towards that field, then if someone looks at your profile, they may know that okay, fine, this is really a very good candidate and he is truly interested in the field, and definitely he will make some difference in that field. So that sort of feeling will definitely help you out to secure a good residency. So that's what I want to say first. And about the rotations, so it's better to do a hands-on rotation than the hands-off rotation. So to do a hands-on rotation, it's available only when if you are a student. So the best time to do a hands-on rotation is soon after your internship. So soon after internship, you won't get your graduation for about at least 6 months or so. So between that time, definitely you are a student. And if you apply for opportunities there in the US, you can get a hands-on opportunities. So that's so that you won't get an extension too. And meanwhile, you will also complete your internship. So you'll be really in a very good mind to do concentrate on your observerships too. And meanwhile, you can do your step 3 examination, and you can apply for the match the next mean the immediate match after your graduation. That's a good idea. And as Shabani said, networking is really very important. And if you can reach out to your seniors who are already in the US, and if they can provide you some observership opportunities, then that would be really great. And through your seniors, it's all about connecting with people. So me and Shabani has linked with a lot of our seniors over there, and like Shabani will be discussing about something else, and we get to know about each other and stuff. So that will be really helpful if you can do that. So the rotation time post MBBS is a good time. So to do your rotations post CRRI, you must apply for these rotations at least after your final year. So before reaching out to a persons, you need to show some interest in that field. Do some awareness camps or whatever volunteering which you can do, and try to improve that. So if you have a good portfolio, you can get a good observership opportunity. And if you have a good observership opportunity, you can land in good residency too. That's all about it. Shabrini?
Yeah, sure. So I'll go ahead with other aspects wherein you can improve your CV. So first thing would be research experience. I know it's not very common to find a mentor in our region to teach for someone to teach us research, but still in every institution I have seen that there would have been at least one faculty who is interested in research and who would be working in research. Though we when they it's not prominent to be seen from outside. There are some faculty in every institution, at least one from every department who is really actively working on research. So, firstly, approach them, help them in very basic works of research, and ask them like where you can start, and tell them about your journey and express your interest in working towards research. Okay, so starting to work on research. I think the best time to work on research would be your medical school. Post that, you will not be able to find cases, mentors. It's going to be difficult, and you will also have other things to take care on your own, like be it exams or rotations. There'll be many other things later on in the journey. So when you're still young and fresh in your medical school, I think that's the very best time that you can work on your research experiences. So actually, me and Aravind, we first started working on the research during the COVID lockdown when we were in our third year of medical school. When when we came up with the idea of let's start doing a research paper, we to be honest, we literally didn't know anything about research. That was the very first time we were approaching. Luckily, we got a mentor who guided us through this process, and it was also our constant effort and interest in learning it, because the whole world was in shutdown and people were like enjoying their times, but we were committed in doing research and contributing meaningfully to the world and to our journey as well. So at times it takes things like this when other people are maybe they are chilling out, they are relaxing, but you got to stay committed to what you have got to do. So that's the difference it creates, right? The hard work it takes to reach greater things, I would say. So first thing you can do is research, and another time where you can do the research is when you come to US for rotations. You can reach out to your mentors when you find interesting cases during your US clinical rotations. You can approach the mentors telling like, can we work on this case, can we do the like a case report or case series based on the number of cases that you see. And the mentors are really going to be very cooperative, but the ethical institution and things being a little more strict here in the US, it's like you have to approach your mentors to know the correct process of doing the research. So these are the two best times that you can do research. And other things that can that really value in your okay, other things that really value in your CV is the volunteer activities that you do. Be it simple things like when the things that you encounter when going to your community medicine rotations during your internship year, the cases that the cases that you see in primary health centers, or be it any health camps that you organize. Because like we were Shrija, Arvind, and myself, we were part of RCM as well, right? And also on behalf of IMA, we had health camps conducted in old age homes. Like we were doing many voluntary activities that way during our final year and CRR at times. So that really makes a difference at this point of time. So back then we didn't know like we were doing this all for USMLE or anything like that. That was not the focus back then. So show genuine interest in your field and like helping out people genuinely, and it's all going to matter at the end. It'll really make a difference. Now, when you're applying to residency and when you think back about your life experiences, these are going to be very valuable ones. And US people really like when you contribute to the society, be it helping in the least possible way, even like contributing food or blankets or doing health camps, in whatever ways it may be. It's not just that it has to be medically, it can even be non-medically contributing to the community. It is all going to be of so much value at the end. And about I would also like to add about the timeline before winding up the session. um, I think there is always two timelines to work on. It is not during the first year or final year medical school. It's not when you start. I would say there is always ideal timeline and our timeline. So there is always something called ideal timeline. Everyone would say the earlier you start, it's better. Start like as early as during the first year of medical school. The ideal ways are that, but when we come to know about the process, when we make our minds ready for it, and when we equip ourselves and when we make up our mind to start it, it's, I know it is definitely at least third or final year of medical school. So but still, don't give up, and it's never late, it's never late. So, like when we and Aravind started, like we started our preparation as early as like third year of medical school, but we were not really able to give our exams during the medical school or even during the internship year. The month we took exams were like 3 to 4 months after graduation. That was when we gave the step one exam. So, but I would say uh, so the like it's never too late to start. Okay, so firstly in this process, just draft a timeline and stick to the timeline. How you should draft a timeline is that you should keep in your mind that which match cycle am I going to apply to. Is it going to be 2026, 2027, or 2028? So firstly, fix the match cycle that you will be applying to, and then I would say draft your timeline retrospectively. So if I have to apply to this match cycle, then I should be ECFMG certified by this time. Then I should have been done with my US clinical rotations at this time. So then when should I give my step 2 exam? When should I give my step 1 exam? I think the retrospective way of drafting the timeline would really be helpful. And also like so that you are committed and fix it to one match cycle rather than like messing up with the timeline and ending up somewhere in the middle of, oh, should I apply to this match cycle or the next one? To avoid such confusions, firstly, keep your goal targeted to which match cycle you're going to apply to and work on from there. And then about the exam preparation, I would say like use minimal resources and have a dedicated study period, and also take the exam when you feel like at least your mock exams are you're getting your desired score in your mock exams. You shouldn't wait until you are ready to give the exam because you will never feel that you are ready for anything. At this time, myself and Aravind, we are getting interviews and we are giving interviews, but still doesn't feel like we are ready for it. Every stage of this process, you will never feel that you are ready. So when you are up to the level of getting the desired score, or you are like very good at communicating skills and things like that, you should just go for it, I would say. Would you like to add on anything, Aravind?
Actually, there's a very good speech, and Shabani is a very good planner than me. So she plans everything at a particular spot, and then finally she makes that happen. But me, I put a lot of plans which is not possible, and some of the impossible plans. But still, like I don't do that plans, and finally I end up in something else. But finally that works out for me as well. But it's better to have a proper plan. That's very very important. And about the exam strategies, it's all fine. So, oh, sorry, I was about to say something and I just deviated. So yeah,
That's okay, come on.
what I want to say is, don't expect a perfection in everything. Don't expect a perfection in everything. You just start with whatever position you are in currently and try to make a progress. So even if something happens, definitely everything it can't go 100% correct. So life is all of imperfections. It's not about the imperfections you see. It's about how you make the progress to make it perfect. That really matters a lot. If you score low marks in your step 2 examinations or your step 3 examinations, try to match up with that research, or try to match up with some voluntary experience and try to improve your profiles. So just by getting 1 mark low, it doesn't mean that everything is lost. You can still make something more about it and make some progression and make your application very perfect. That's what I can say.
That is again actually a very good thing about USMLE, because if you didn't give your best in one step, it doesn't mean the end of the world, or it doesn't mean you're out of the game. You still have many other things coming up where you can prove your excellence, where you can prove your genuine interest, and you are still in the match journey. So you can show them that what you have learned from that failure, what are you taking forward, and how you have improved that in your journey. So it is always a continuous process of learning. So on a nutshell, I would say you should have believe in yourself. You should have family and financial support, because never give up in the middle of this journey. Then all the hard work that you have put in until then would be of no use. So never ever give up in the middle. So when you're about to start it, just make up your mind very strongly, and then keep going whatever comes your way, and you're definitely going to make it. Because people have had this self doubts, and everyone has gone everyone who has cleared USMLE has definitely gone through all of these hard sims, and they make it to the other side. So it is never an impossible journey. It may seem difficult, it is long, but it's never impossible. And we are also there to help you guys in whatever ways you want. We would be happy to share our contacts, because we know how much hard it was hard for us to reach out to people, and like building each and every person in our network. So and we always keep talking that we should give back to our juniors, and we should make this journey and at least an easier one in the possible ways that we can. So at the end of the session, we'll leave our um, contact details as well in the chat, so that you guys can reach out to us later in about like whatever ways or help that you need from us. So currently I'm living in Chicago, and like we are in the process of attending interviews. So we are happy to help in ways that we can. Now we are actually open to any questions. So you can unmute yourself and ask questions.
Before that, I want to say about two things. So one is like you must have a proper good mentor throughout this journey. So whenever you feel low, you can just call them and then say about like I'm feeling this, I'm feeling this. I mean, the mentor must be someone like who has already undergone this journey. That's one thing. So they will definitely help you a lot. So sometimes like your study partners may be your mentor too, and you must have a lot of study partners. So definitely they will help you a lot. So you'll be having a lot of peer groups who is undergoing such similar stress and frustrations too. So sometimes if whenever I feel like low, like I just call Shabani, Shabani, this is going on with me, and and she will be just hearing to all those rants, and finally I'll get cleared, and then I'll just move on. This is how it usually goes. So you just have a lot of your study partners. They will definitely help you. They will motivate you, and don't feel like studying at all. So it will be some more enjoying. So you'll be discussing something what you know, and you'll be receptive to their learnings too, their teachings too. So study partner and mentoring you must have in this journey to make this journey happen, and to make this journey feel easy, not very a difficult one, and you can even enjoy the journey too. It's not about the destination which brings you happiness, it's about the entire journey which brings you happiness. And this will be definitely you will be remembering this entire journey throughout your life. That's for sure true.
Yeah, again, the role of study partners, it's not just until the exams. They're going to come with you throughout. So, like Aravind telling that he rants to me, it's not during our exam preparation. It was even yesterday that he called me for about 45 minutes telling like things are not going the way that I'm expecting. So, the role of a study partner goes way longer than just beyond exams. So, just find good study partners, and it's going to make your journey even more interesting. So, to go with the question in the chat, how do I craft a personal statement in the ERA CV? Yeah, sure. Personal statement drafting is again kind of an interesting part, I would say. It's just telling your story in a very interesting way, like most possible interesting way that you can. It is never the first draft that is going to end up in the ERA CV. You firstly you draft all your ideas. Okay, so what all you wish to be conveyed in your story. Again, it's not highlighting all your accomplishments that you have already mentioned in your CV. That is already there in the CV. So tell something that you have personally undergone. Okay, you have to express your life as a story. So make a note of points that you would like to add on to the personal statement, and write it in a story format. Okay, so keep drafting that. Like it goes usually like 4, 5, 6, or how much ever draft it takes to come to the perfect word limit, the format, and everything. It is a process of at least a couple of weeks to 1 or 2 months. to answer more specifically, Santosh, if you can unmute and say like where exactly are you in the USMLE journey, then maybe I think we can help you more specifically.
Greetings, ma'am.
Yeah, sure. Please.
Ma'am, I'm currently in my final year of MBBS and I have attempted step one once but got failed in it. I'll be reapplying for step one after my final year, before the internship.
Okay, so for now, I would say suggest you to focus on your step exams and clinical rotations, because seeking clinical rotations are, again, it has to be planning is needed in every step of this journey, because everything closes like way early. To apply for an exam, you have to apply at least 3 to 4 months prior. To apply for clinical rotations, you have to apply at least 4 to 6 months prior. So that's how competitive every spots are. So for now, I would suggest you to focus on step exams and US clinical rotations, because you will again gain a lot of experience during your clinical rotations that you can add on to your personal statement. So I feel now working on personal statement is a little early in your journey. So when you're done with your exams and rotations, you will have a even more better idea and better experiences to talk about, and you can draft a personal statement like about 1 or 2 months before you apply for the math season. Like when you're working for the process of ECFMG certification, you can maybe simultaneously work on your personal statement and to get like even more valid experiences, I would say.
So one thing you want to add here. So Santosh, are you
Yes, sir.
there? Okay. So if you have any sort of red flags, so maybe failing in steps or whatever it is, or failing in your university examinations, or definitely everyone may have some red flags for applying for residency. So in the personal statement, it's better like if you can talk about the red flags too, and don't talk about that like you have such sort of red flags. You better talk about like how you handle that. The way you handle the problem is really very important for a good team player and team leader too. So you must be able to face a problem, and the way you handle the problem is really very, very important, and that really defines you.
Yeah, that's a good
Okay.
add-on.
So you can add that
If
in your personal statement. So that will be really interesting to hear your story for someone.
if anyone has any other questions, like you are, feel free to please unmute and ask. Okay, there's someone. I don't know.
Yeah, Arunagiri, I think you can unmute and tell that.
Oh my God, that's a very big question.
I was
Yeah,
typing
Arunagiri.
all the way. Yeah. Good evening, sir and
Yeah.
ma'am. First of all, I really want to congratulate you, as well as I want to like give my wishes for your interviews ahead, and hopefully, sir, everything will be goes on as you planned. So further, you won't rant anymore, I guess so. So this is this is Arunagiri, final year MBBS from GMCS Tiruvallur, sir, and I am the first batch of my college, where I don't have any seniors in my college. I'm the only senior in our college, so yeah, it's quite difficult for me to like give my step one right now. Why? Because our college didn't get ECFMG certification as for now, and there's no sponsor noted for our college. So for that, first batch has to get passed out, it seems. So as for that timeline consider, I'm just focusing on my CV, like doing multiple research works and doing various initiatives, as well as I've been doing lots of things that you have mentioned, community outreach programs, and been part of many organizations as well. So and doing multiple researches as well. So all I wanted to know, like what are the possibilities of an IMG like us to get into USA for a surgery residency, sir?
Okay. Thank you so much for your wishes, Anagiri. And also, we are wishing you for choosing surgery, because that's not like people commonly take like prefer internal medicine, pediatrics, and I've even seen neurology. But for you to choose surgery, it's really hats off to you again. And I wish that you don't change your mind going forward in the journey. So
Yeah,
for
thank you,
you
ma'am.
to
Actually, I've been battling with myself with the thing in my mind as well. To be very specific, I want neurosurgery, ma'am. I know
Oh,
the
that's nice.
consequences which I'm gonna face in future, but I don't want to change my mind right now. So I've been working very hard for that. But the only thing I have with me right now is I can't give my step ones right now. Why? Because our college didn't have a sponsor note yet. So I've been talking with those seniors and those who are I'm networking with people. They are telling like just focus on your CV and your preparation. Just wait for your college to get the approvals. When it got approved, give your step one and step two and just get into the US. That's all we needed you guys to do. That's what they're saying. But I need to know about your perspective regarding this one.
Okay, so again for neurosurgery, your journey is going to be a little more longer and harder than any other specialties. But again, it is not impossible. Okay, people have made it, but it's just going to be a slightly longer journey. And then again, to accomplish is to get into such complicated specialties, they would expect us to have really good scores and like focus on your step two score and on your research papers. I would say. Do all of your research focused on the topics of that really interest you, okay, and also find a mentor in your field of interest. I think surgery and neurosurgery is actually different pathways, it's not the same. Yeah, I think Arvind was about to add something.
So actually speaking, don't think much about the difficulties you're facing currently. So one thing is, even it took about 6 months for me to get ECFB certified at the very beginning, and even at the last also I had similar troubles. So everyone will be facing a lot of, even though if the college is ECFB certified, but still we still face a lot of troubles and issues. That's pure, it's completely natural. You don't need to think about it. To say with neurosurgery, so what I would recommend you is like it's better like soon after your internship period, just try to apply for your neurosurgery hands-on rotations. It's available in Cleveland and some other institutions, University of Alabama, and I mean I don't remember that properly. Even I know a few of my juniors like who are preparing for neurosurgery and surgical fields. So the better, the best thing would be trying to show some interest in the field. So if you can do few researches in neurosurgery, and if you can do some hands-on experience in neurosurgery, and in the meanwhile, like if you can do some case reports while in the US, then at the same time you can also ask for research positions. So one of a batchmate's sister, like she's actually a neurosurgery aspirant, and she actually did the same. So soon after internship, she did observerships, and then she got into a a research position, and she worked for about 3 years in the research position, and then finally she applied for neurosurgery match this season. So there is still always a chance. Just show some passion towards the field. That's very very important. So frame it in such a
Yeah,
way that
thank you, sir.
everything is catered towards neurosurgery, even if it's a small case report or even if it's a review article, or definitely even though if your college doesn't support, you can still do a review, a systematic review. You just need to sit in a table. You can just gather a bunch around of people, and then you can just speak about the researches you see, and you can just form a systematic review. That's the easiest way which you can do at this moment. And you can also put some case reports, and with that case reports and research experience, you can reach out to professors in the neurosurgical department in the US and ask for some observership opportunities, and during that observerships do some other case reports too, and also ask for a research opportunity. Do the research opportunity, and definitely there is a chance that you can match into neurosurgery residency too.
Yes, sir. So if
even
you don't
even
mind,
though
like,
you don't I'm sorry to interrupt.
yeah.
Even though if you have not given your step exams, but when you have done your research work and you have something published, you can connect with neurosurgery attendings over here, telling that I see you have worked like this in your paper. I have worked on something like this, and you will have a common connect. So people will really value research over here for all the hard work and the knowledge that you have towards that. So it's not just exams that is going to take you forward. It's just that the exams are getting delayed, but still, research is a very strong tool through which you can connect to the people here.
Yeah, yes, ma'am. Ma'am, actually, you told us before, like, in our system, research is not that much prominent. In our college itself, we can't find a perfect research mentor in a specific department. Even in our college, there's even doesn't even have neurosurgery specific department itself. So it was very quite like it was very difficult for me to search a mentor in that field. But I've been doing a lot of works. Like I have published two PubMed Index journal papers, and I've been working on several scoping reviews as well. In the field of neurosurgery. But will they value a scoping review or something? Or narratives? Yeah, I know they value the meta-analysis and the systematic reviews, but currently I'm in my final year. I couldn't give that meta and I mean SRMAs right now. So is it possible, like, you have any networking? I mean, with your juniors or someone else who are preparing for the either neurosurgery or surgery? It will be very useful for me to like have a networking with them actually.
Yeah, again, please reach out to us after this session as well,
Sure.
so that we'll be able to help you connect with people. And again, see, with you being the first batch in your college, and still you have figured out ways to like get such valuable research experience and publish it in PubMed journals. That's a really great things. I can see the drive and the interest that you have towards the field and everything. So this is going to take you definitely going to take you a long way. Okay. All the best. Keep going.
I really appreciate it because
Yeah,
it's not so
yeah.
easy
Thank you so much.
being in a periphery college and then aiming for neurosurgery, that too in the US, and doing two competitions, that too in your final year without any mentorship. That's really very great. I really appreciate it.
Yeah,
Yeah,
I don't
anything?
have mentors in my college, but have a lot of mentors outside this college. Like I have a lot of people in IMA. Even I'm doing research with Srijaka right now. So
Oh,
yeah, I've
nice,
been doing a
nice.
lot, right? I've been doing a lot, but I'm just started to focusing on the neurosurgery field, as you told. Like I've been touching all the field right now, like orthopedics, psychiatry. Why? Because I've been getting the mentors in that field only, so that I'm just focusing on that field. Like when I approach a neurosurgeon, they aren't getting a time for doing a research with me. So that's my problem. I'm just facing right now. That's why I'm just trying to give maximum networking with the people whom I'm approaching, wherever I'm going, any USMLE like webinars or something. I'm just trying to have a networking with them, and I'm just trying to pull them as well as their juniors who are doing the neurosurgery residency and who are who are preparing for the neurosurgery. So I'm just pulling everything as far as I could, man.
That's so
Arunagiri, are you the
wonderful.
one
You're already working on it. Yeah.
who is doing a team-based research in IMA?
Yeah,
Are you the one,
yeah,
Srija?
yeah. I'm the one who started it actually.
Who started the research sessions. He's the mastermind of it. It is called Araichi and it is going successfully. It's publishing every session on research publications, and all the mentors are arranged, and he's working on it, and he's also helping others to do research. And I'm also part of it. Though I'm his senior, he's my mentor on research. So it is like everyone is there from junior to senior without a difference. There are people who is doing research under him. So he's my dearest brother who has guided me in MSN also. So this is Arunagiri, and he's published. I think he has prepared 10.
I'm really happy to see your
Yeah, yeah.
enthusiasm. So
Yeah, that's
when I
so
was the first
wonderful.
young person in MSN, like I actually started a similar program which we call it as
Thank you, sir.
thesis, but it didn't work good. But still, like that was the first initiative which we have done in the entire IMA period. Like we gathered a group of about 5 persons, and then uh, each 5 members will be having, I mean, we'll be allotting things. And sometimes I even said that, like, if there are a group of two groups, if one group is giving a
Yeah,
paper and the other group is also giving paper, we can just mix the names by just giving some few works to do.
yeah,
So then by the
yeah,
end of at least a year, everyone will be having at least 2 to 3 papers, right?
Yes,
So
sir.
that was the
Sir,
plan.
that's what I'm
This is
doing in
what
my
the person.
college, sir, actually. That's what I did. I started to do with my juniors, those who are planning for give their steps, and those who wanna like get into the USMLE or pathway or AMC. All they wanted to have a basic research. So I just started a group with them, and those who are interested in that, we just started to collaborate. And I'm having almost 15 papers in my college. And outside this college, I just started this RIT, and we are in the verge of giving those IECs process right now. And yeah, I'm really having a great team as well as a great mentors in IMA right now, sir. So they have been guiding me so long, so far, and I have got a strong pillars in here actually. So we are planning to like give this proposal almost 30 proposals right now. So I'm just
Oh,
taking the next step. Like yeah, we are just going ahead with the 30 proposal, which we gonna like uh, uh, gonna cross this IEC the next month, which is there happening in that's IEC is happening in IMA itself.
oh wow, that's great.
You're doing a fantastic job. We would actually love to connect with you after this session as well. Now we are open to other doubts if someone else has doubts as well. Like we'll talk more. Sure, for sure.
Yeah, definitely. When it comes to research, you can reach me anytime. But I really need connection from your side as well. Like when it comes to USMD, I really need your connections as well, ma'am and sir.
Definitely,
And even
definitely.
I just tortured Srijaka to do a USMD webinar. I'm the one who tortured her. That's what she told in the beginning itself. So I really like that was a very great explanation. Like you are a timeline. Why? Because people like me, I don't know nothing about the USMLE. I just sat and watched all those webinars which are conducted by the North Indians people. So they will be like, you have to give your step one and step two in the third year, and when you are giving the step two after your internship, then only you get matched in those USMLE thing. But when I came to know Srijaka's batchmates are giving their interviews right now, I'll be like, there's a hope. Don't worry. So that was the first thing that was the first thing I had in my mind. So I really want to connect with you guys, and I really want to like know your pathway, how you've been working on. Yeah, that's mind blowing actually. And even though if you have any red flags with us, you are like that's not an issue. Even these little things are means a lot to me. Why? Because I'm gonna give my step ones and step two. For sure, I'm gonna give it later. Either 1 or 1.5 years after I get graduated. But even though I have those things as a red flag with me, if I had a very good research or a very good CV with me, I guess I can get into it. That's what I am having in my mind. But I want to confirm it with the people who are preparing for the like neurosurgery residency. Why? Because I don't know about the people's mindset who are in that program. That's my problem actually right now.
You don't need to worry
Okay,
about. So
we are really happy that we have given you that hope, and also
Yeah,
that all that we have conveyed has reached in the very right way. So we are really happy about that. And of course,
yeah,
we would love to help you. So just please note the contact numbers that we have left in the chat, and you can reach
surely,
out to
surely,
us. We are really very happy to help you.
surely, ma'am,
so
surely, sir.
one more idea I had during my tenure as the college chairperson as MSN. So the thing is, yes, I know that like it's really it's not very easy to reach out to your professors in the university department in your college, but there is still a chance that you can reach out to your professors in the private or some
Yeah,
private. I mean, private doctors. They will be really interested to help you out in putting some case reports because I mean, when compared to government, I mean, when compared to government, I mean, when you're comparing government and private, there are a lot of research opportunities. Sorry, there are a lot of laboratory investigations and some complex tests and some complex therapeutic procedures which you can do in the private than the government, right? So if you're able to
yes, sir.
connect with those type of professors, so then that will be really helpful for you because they won't have enough time to do any research or they won't be I mean put any papers. So if you can connect with them
Yeah,
and if they are able to provide any interesting cases to you, then you can put a lot of case reports, right?
yes, sir.
I actually tried that in my college, but still that also didn't work out. I mean, because at that time it was COVID season and yeah.
Yes,
try
sir.
to reach out to
Actually, that's
other.
what I'm trying to connect with people, sir. But it's very tough to get a neurosurgeon who is doing the research as well as is
No.
that neurosurgery thing
Don't
with them actually.
don't search for persons like who are trying to do research. Try to search for persons like who are interested in the field, and just politely ask them whether if you can contribute anything, or if he is encountering any interesting case, if you can just
Okay.
write up that case and put it in a paper, put it in a journal, then that will be really easy, right?
Yes, sir.
So try to reach out to them. You just ask them if you are. I mean, you must be seeing a lot of interesting cases. If you can give me such
Yes.
cases, and I can just do the write-up work, and I can just publish it in the neurosurgery journal, you can say that. You can definitely say that. Try
Yes,
to
sir.
do that,
Sure,
right?
sir.
Because
Definitely,
like
sir.
you have already done a lot of achievements. If you can just do this one more thing, then it'd be really helpful in your career too.
Surely, sir.
Because I tried, doing systematic reviews. At the same time, I also tried to connect with professors through IMA, because IMA is a private organization, so a lot of private doctors will be in contact with the IMA members, right? So through these members,
Yes, sir.
like you try to reach out to those professors, or to those private doctors, and try to do some write up. That will be really helpful for you.
Surely, surely, sir.
Any other
So
questions?
thank you so much, sir.
That's
I
okay.
guess that's all from my side. I'm just
That's
using
okay.
this webinar by watching other
Any
people's.
questions from
I'll
everyone?
just contact you people, sir. Yeah, thank you so much, sir.
Yeah, sure.
So, sound, sound. Yeah, I ended up motivating everyone to, like, they can still have a hope to do USMLE even though they are late. So thank you, Arunagiri, for yeah, you can contact them and they'll guide you further. So I had personally one doubt. What is the difference you have faced in US practice and Indian practice? That major differences you have. Maybe this thing is kind of good in.
Okay, Shrija, if I'm not wrong, you're asking the difference that we found between the Indian and the US practice, right? Yeah. Okay, so one major difference that I did find when undergoing like bedside rounds is that in the US, patient is the boss. He is the one who decides what needs to be done for him, what he wishes to undergo, and even if be it the husband or wife, it is the patient's choice to even take the call that if their spouse needs to know what's really going on with them or not. But on the contrast, in our practice, I think the decision making is like a family's decision or a joint decision, wherein there are too many relatives on the bedside, everyone discussing and coming up with what has to be done, what not has to be done. So I think, and it is like, it is the, uh, what is it, the unwritten consent that the spouse gets to know everything, the family gets to know everything. And maybe if someone has like three, four children and everyone coming up with suggestions for how the treatment has to go on. So that's how it is in our setting. But in the US, it is like everything is the patient's call on how much the family has to know, what has to be done. They value the patient autonomy above everything else. If the patient is even in his intact mind, he refuses to undergo treatment for even the most complicated thing that is happening to his body, it is his very own right. So be it even very complicating case like a septic arthritis, if not treated, the patient is going to go to sepsis and he's going to even cost his life for that. If the patient understands that and even if he still refuses this treatment for that, he has all the right to do that and we just have to let him go. That's how it works.
There is another example, like for example, if you're doing a surgery, and incidentally, like if you find a tumor, you must not resect the tumor. Must not take a biopsy of that too. You must close it, and once the patient wakes up again, And then you need to say that like we have found a tumor. Unfortunately, we have found a tumor, and you want me to resect it? You need to ask the patient in that way. So this is completely ridiculous, because if it's an Indian setting, like if we find a tumor or if you find a Merkel's diverticulum, we just take it and throw it away. It doesn't work that way in the United States. So you need to get consent in every steps for every procedures. So you can't do two procedures at a time when the patient is in anesthesia. So that's the funniest part. And there are a lot of advancements here. For example, if it's in terms of cardiology, there are advancements like LVAD, left ventricular assist device. So where you'll be just drilling a hole in the left ventricle and sucking all the blood out from the left ventricle and putting it into the aorta through a machine. So some sort of complicated steps and procedures can be done in the US. So which is not economically possible in India. So that's the difference in the Indian setting and the US setting. Yeah, anything else? And of course, definitely you will be having a very good lifestyle, and you'll be earning a lot, and you can spend a lot in the US. How about it, Chavani?
It's like
Is it?
not just earning. Again, the cost of living is very high here when compared to our country, okay? The
Yeah,
expenses that you have in our country and all, it's like you can easily have a life there. It may seem so fancy. Again, it has a if both the places has its own pros and cons, I would say. Yeah, please go ahead, Shija.
Okay, I think Shabari is enjoying that privilege. And
I'm sorry, Shija, your voice is distorted. It's broken. We are not able to hear you. Still, we are not able to hear you. Oh.
Okay. Can you specify the time? How many days you have to go for? Like, is it the same? Is it okay?
Yeah, it's okay. It's good now.
Okay, the observation. Okay, you are doing there. Is it similar, very similar to the internship you do there? Maybe the switch off the video and that's better. So the
Okay.
observership is equivalent to internship, or you have to do there, or how many days you have to go in each and every department? Are there
Again,
more days?
yeah. There are two things over here. They call it observership, externship. Externship is gaining hands-on experience, like getting to talk with the patients, like or reviewing their records, having access to the electronic medical records over here. Those are the hands-on things that you get to do, and that's called externship. In observership, you are not ethically allowed to talk directly to the patient or do anything hands-on. In observership, you just get to observe, or other words, it's called shadowing the attending. Just shadowing the attending, being like functioning as a shadow. You just observe all the things that's going on over there. You're not allowed to do anything ethically, because ethics play a major role over here. If you do any one thing ethically incorrect, then people are ready waiting. They're readily waiting to sue you and like file lawsuits. It's like the fine they charge over here is so crazy. So the ethics are above everything over here. And the clinical rotations, I would say, it is just the opportunity for us to get to know the US healthcare system. Like it is not that we don't know anything and we are going to learn something new. It's never that. The knowledge, the content, the experience, everything that we have gained from India, we gain from India, is really of so much value and important. It is important. What we do here during the clinical rotations is just getting adapted to this healthcare system, of how things happen over here, how the patient meetings go, what is the role of a resident, or what is the role of a medical student, how they interact with patients over here, how they build rapport, and the methods in which they do the bedside procedures and everything. Just getting adapted to this healthcare system is what is the main aim of the clinical rotations. Shrija, again, we are not able to hear you.
Okay, I think it's better you
Okay.
turn off
Okay.
your video.
We get it now.
Yeah,
Yeah.
it's
Switch off the
good.
video. Yeah. Okay. So if there are more questions, you can go ahead, or if anything
Yeah,
you want to
we.
share. Any interesting
How
experience in?
actually I want to ask one thing.
Yeah. Yeah. Sure.
Like,
Sure. Go ahead.
what's the total expenses it happened so far till now, ma'am? Like, till you apply for your, interviews to those universities, they'll be charging certain amount. It seems, ma'am. So from the starting of your preparation or getting your U World, from getting your U World, still staying there, giving your interviews over there, how much
Okay.
it costs, so
Yeah.
that we will made up our mind like, yeah, this will happen. Maybe it will increase in future, so it will be more useful for us.
Okay. To give a very rough number, I would say have at least 15 lakhs. Okay. Have in mind that it is going to cost at least 15 lakhs, I would say. It's not. mm Again, to give a range, maybe from 15 to 20, I would say. But just be prepared for that. And you can always look on ways to reduce your cost in every step, I would say, because it is up to you totally. When you're purchasing UWorld, you can buy a brand new subscription, or you can buy from someone on a second hand, or you can entirely use an offline version that's available in the Telegram. Like, it is up to you to choose. But again, if you go for an offline version of UWorld, it is again risky. There are risk factors, like it may have some outdated questions, some new updated questions might not have been updated over there. And because UWorld also has some revisions happening every year, so there are again factors like these that you have to keep it in your mind. But there are ways that you can reduce cost in every step. Like, for instance, the one I told you right now. And when coming to you is again to do clinical rotations, it is things are very pricey over here, and that too when we are transitioning from India to US. Like, the constant calculation conversion no keeps on happening in our mind. If we are spending like $20 for a cab, it is like, oh, 20 into 84, is it costing this much for a cab, is it costing this much for a single meal. So that conversion keeps on happening. So it is like up to us to keep the expenses at a very minimal range. When you come over here, maybe if you cook, then the expenses of the meal are going to go down. When you find accommodation closer to the place that you are rotating, closer to the hospitals that you are rotating in, then you can maybe go have a 10 to 15 minutes walk to reach the hospital. Then the transportation cost is not going to be there for you. And then when you have your seniors or anyone over there living close to the hospital, and you find some cheaper accommodation options, then that is going to make a significant difference, right? So when you're opting for a single room apartment, it is going to cost about 900 to $1,000 a month. But then if you go with someone, if you share it with someone, or if you go for other options like that, or if a senior of yours is living close to that and he's ready to like accommodate you for even for free of cost, then you're going to save that $1,000 a month. So there are like numerous ways like this wherein you can find options. And also, when choosing for rotations, there are options available wherein you go for a paid rotation, where there are free rotations. When you choose to do rotations in university hospitals, they are going to even charge you as high as $4,000 to $5,000. In community hospital rotations, they are, I think, charging between $1,500 to $2,000 per month. At times, if you know an attending over there and who is having an outpatient clinic, and he's offering you a free rotation, then you're going to instantly save that $2,000 a month. So there are always ways like this. You can always plan the journey according to your budget. But roughly, it is at least going to take, for all the mandatory steps like exams, subscriptions, and travel charges and everything, application process, it is at least going to take 15 lakhs.
Yes, ma'am. Thank you so much, ma'am.
But again, all of these are like investment. It is not that it is you're spending too much. It would we would really feel guilty that we have completed a undergraduation degree and we are still dependent on our family members financially. When our peers have started earning and getting their own money, we are still dependent on the family. And there are going to be moments where you would feel guilty for that. But again, this is like an investment. You are still under the preparatory phase. Once you are here and once you have started earning, you're going to definitely pay back much more to your family, right? So things like this, it may uh, emotionally worry us, but again, we have to put all of these behind us and keep working on the journey.
Maybe the worthy investment.
Yeah.
Thank you so much, ma'am.
Yeah. Any other questions?
I think if there are no further questions, we can close the session. As yeah, it was a great session. It went for 1.5 hours, and I think it was yeah. I think we can close the session if there are no other questions. Darshana, if can we?
Yes, ma'am.
Okay.
I
So
invite
it
Dr.
is my
Shrija ma'am to give the vote of thanks.
yeah. Okay. So here I thank Dr. Shabarani Srikumar and Dr. Aravind for giving their valuable thoughts on USMLE and also guiding our participants on this session of Thiran. This is our fifth session, and I'm very proud to see you guys, to see both of you guys in this platform, and I think we'll be connecting more with more achievements from you guys in future. And I congratulate both of you for achieving this level, and also all the best for every future endeavors you are in. So also yeah, I personally thank Shabarani and Aravind for taking in this uh, invitation for Thiran and joining us as speakers in a short time and preparing for us and doing it in a very fine way. Thank you, Shabarani, and thank you, Aravind. And
Thank you for having
thank
us here, Shrija, and we would love to come back here as internal medicine residents soon.
yeah, we are expecting that to happen very soon, and at another session on USMLE, maybe 2.0, to get to know more about USMLE and things in US. So thank you, Shabarani, and thank you, Aravind. Okay, so I also want to, yeah, we are waiting for it, Arunagiri. Also, thank you for sharing your contacts and helping us out, and all the participants will be using it in a good way for USMLE guidance. So thank you guys, and right now I'm happy to announce 2 more sessions on Thiran. That is, I'm very proud because in the 6th session, it was very short time, and I have got 2 speakers on UPSC CMS for yeah, UPSC CSE civil service for the next sessions. So I'm sharing the screen for yeah. This is going to be our next session. If you guys can see my screen, is it visible? Okay. This is going to be our 6th session on UPSC civil service examination, and our MMC graduate of 2016 batch TM, 16 batch, Dr. Prashant sir, who is our assistant collector and my dear brother, and he is going to come for the next session on UPSC CSE. And I think everyone will get benefited with this session, and also will my dear Akka, Dr. Nitila, she's our alumni 2015 batch of TVMC. She'll also be joining for UPSC CSE. So this is going to be our next session, and the other session will be the 7th session of Thiran. It is on INICT. So stay tuned for both the sessions. Don't miss the dates. And also for Armagiri, there is RIC for all the USMLE aspirants. You guys can participate and go on with the research and build the CV. He'll be the best guide and mentor for you guys. So also saying RIC will be there to guide you guys on research. Contact Arunagiri for RIC, and we have Thiran sessions coming up. We'll be joining soon yet again. So thank you guys. Thank you everyone. Thank you Shabarni and Aravind for joining us. Thank you all the participants, especially Arunagiri, and also Santosh who has asked the question earlier. So also I'm thanking IMA Emerson Tirunelveli for organizing this event. Thank you guys. We can wind up for today.
Thank you, ma'am.
Thank you.
Thank you, Ka.
Thank you, Da. Bye bye.